We have some shifting here on that L5. There it is. 6-7's actually rotated on the left. We're going to adjust it on the right. Put it down. Good. Nice zoom in shot. See, it's adjusted as that PRS there. Nice. There, it looks good.
It's looser.
Awesome.
I have a little bit more work to do, but
right. As always, work in progress.
Much better.
Right. Yeah, it's been about what?
Yep.
A couple weeks now
Maybe,
on care.
Maybe 3.
Right. As you pretty much had that neck pain sort of up on that right side
3.
still, right?
Yep.
Okay.
Right up in here.
Got it.
Base of the skull down to my shoulder.
Got it.
Neck tension.
Got it. Okay. All right. So we're going to start out with the scope here. So again, the scope's measuring for any nerve inflammation. So the inflammation gives off heat as a byproduct of that. So this will show us exactly where the inflammation is in the spine. Good. See some up top there today. And a little at the base right there, the base of the spine. That's really where it's mostly coming from for you. It's definitely coming from the base and it's traveling up that right side.
Traveling up to the neck, yeah. And that where you identified is exactly where I feel it this morning.
Yeah, a little bit lower. Yeah, more at the base of the neck. Yeah.
And then I think my shoulder injury is what's making my behind my scapula hurt.
Right. On that left side, the left scapula? Yeah. Another reading there at the base of the scapula too.
On the right side?
It's always on the right side. Normally it's where, if it's more of a chronic type reading, usually it's going to be on the opposite side actually. If it's more of an acute type, recent type injury, it's going to be on the side. Okay, move a little bit down in that low back as well. Okay, I'm just statically palpating, feeling for any areas of swelling. Looking down lower, is a little tender there on that right side?
It is.
Yeah, right on the money. Kind of like right there. There's like a little pocket of swelling on that right joint. Right there.
Right.
Yeah.
I think I told you when I first came in, my low back is what, has always bothered me the most and what I went to seek chiropractic for, care for in, earlier years.
Right. How's the back feeling now? The low back?
The low back, it's better.
Yeah. 5, 6, 7. A little tender here. Yeah.
My neck was so bad I ignored my low back.
Right, exactly right. You usually feel one area at a time. Then once you turn one area off, then you'll start feeling the other one now. Kind of how it goes. A little tender here.
Yes. Right where you.
More so like if I press here versus more tender there.
The bottom, the second one, I think.
That second one, yeah, right there. T1, that's that T2 on the right side, okay? If you look over, so you got T2, T7, and L5. If you look over here on her x-rays, you can see we have some shifting here on that L5. You can kind of see where the spine is kinking off here on that side. So some of those nerves are just compressed on that area. So we'll work on addressing those. All right, Martha, let's go ahead, come over here. Go to this bench here first.
On my roller coaster ride?
You're facing it right, going for a free ride every week, right? Let's bring that up a little bit for you. Cool. Ready? And here he goes. Free ride. All right, so just rechecking the x-rays here, seeing exactly. So we're gonna work on that L5, so a little rotated on that right side. That T7, 1, 2, 3, 4, 5, 6, 7 is actually rotated on the left. We're gonna adjust it on the right side. Now, the reason why we always gown our patients is because we want to be as specific as possible. So a lot of times you see chiros that adjust with the shirts on, and it's just hard to be as specific. We're trying to address just one individual vertebrae without affecting the other one. So having the gown off, we're able to not only see areas of inflammation, swelling, but allow to be very specific. So I know on that exact precise joint we need to be on here. Be right on that L5. Go ahead and relax your stomach down. Good. Good. Just feeding into that joint a little bit. There it is. Good. Nice and specific. 3, 4, 5, 6, 7. Get that in, just that T7 here. Put it down. Good, nice. Perfection. Let's bring that up here. We're going to address that T2 on the chair. Zoom in shot, see it's adjusted as that PRS there. Good, scoot a little bit forward in the chair. Awesome. And go ahead, come all the way back. 7, T1, T2. Just as a PRS, good. Go ahead, just tuck the head down. I'm gonna go bring your head over here toward the right side and up just a bit. Good. There we go. The piece of it. Work a little bit on this left side here. And come down the chair just a bit more. Awesome. Okay, bring your left shoulder down just a little bit. Nice. There, looks good. I always like to re-scope so we can actually see the changes in the spine post-adjustment. See, now it's nice at 0. Awesome. Good, good, good. Perfecto. Now we did the adjustment. I want to do a little bit of work on those muscles. I know for Martha, we have a lot of tension really on this right side. These muscles here coming up in the neck are just really spasmed and tight, and that's due to that nerve pressure that was occurring at that level. So one thing we want to do just to help, her respond and help just get her out of pain as quickly as we can, we're just going to work a little bit on those muscles here of the neck.
The range of motion is improved a lot, but it's still the exact
drastically.
spots. Only there though, it doesn't hurt.
Before it was
on the
when
other.
you rotated to the side, right? So go ahead and rotate toward the left. Oh, it's way better.
Yeah.
Before you were like
right.
halfway maybe, or maybe at 30, 40 degrees. Now you're pretty much at like about 60.
And then the same this way. It's just
so
that
it's pretty
same
much
spot
equal.
both ways. That's
You're
impeding.
equal both sides now. Before you weren't there before. Okay, that's good. It's just pinching pretty much right at that top area. You're right. Okay. Yeah. So what we're first going to do is going to work those lower muscles at that base of the neck, and we're going to come up and really work those tendons that attach up top here on that base of the skull here. So we're going to use our little scraping tool. This is going to work on the muscle fascia, which the fascia is like that little tissue that kind of wraps around the muscle, and that's usually whenever we have like muscle pain or tightness, it's usually the muscle fascia that's actually involved. So this tool was able to sort of scrape that fascia and just allow the muscles to move and glide a lot better, a lot easier here. So you start to see some redness occurring at that level. That's areas of blood flow, circulation going to those muscles, which will help it heal faster as well. I'm just gonna work. Good. I'm gonna work the base of the neck here. Yeah, right here. That's the muscle that's really involved. So what we're gonna do, I'm gonna kind of pin that muscle with my fingers, kind of grabbing and holding that tendon. I want you to go ahead and look down to the left. I'm pretty much right on it right here. Right for it to mess you up, okay. You go down, I'm going to come back up this way. Nice. Now let's do that motion on your own here. So let's look off to the left and back up to that area. Good. It's kind of a hard spot to kind of get up under the skull there, but we're just getting under there and releasing that muscle. As she's doing the range of motion, we're kind of bringing the muscle down into tension. And then as she's coming back, we're releasing the muscle just to free it up a bit. Good.
Yeah, you're right on it, dude.
Oh, yeah. If it's too much pressure, let me know.
No,
That's a lot.
Perfect, as I say. Hurts
Right.
so good.
It hurts so good, right? I always say, you want to punch me while I'm doing it, then give me a hug right after it.
I'll leave that to Lauren.
Right? Yeah, right? All right, let's go down that way. And back up. Good. And down. And good. It's feeling a lot better though, just, you can still feel it's, because before there were a couple of different muscles involved, now it's really just that one.
Before
Right,
this
right.
muscle was really
Right, how's that one
sore.
feeling on the?
Much better.
Much better, good, good. Yeah, I've been working on that. The muscles in the front of the neck were really bothering her. Now it's pretty much just that one area we're still trying to work on here, and it's feeling, I can already start to feel it really release right now. Good. Yeah, right there, good, good, good. Are you okay with the pressure there? Okay, good. Really digging into it now.
Anything if it will release.
And back, and down, and back, good. And around town. Awesome, good. Now just off of that alone, let's go ahead and look off to the left.
To the left.
That's a lot better, good. And off to the right. Good. See, now you're looking more to the, now you have more rotation on the left side. Go to the left
I
again.
can go further to the left.
Before it's the opposite, go to the right. Okay.
Stops it.
Now I gotta balance you out now, right? We'll keep working that. But that's good, that's what we want. Awesome. Okay, good. Now let's go to the left. Good, and go to the right. Awesome, good. Much better.